to the third lecture. Welcome to the third lecture of the series. This lecture has to do with the first step of phase one of the essential first steps. And if you recollect from chapter 2 in the lecture series and the lecture component of the module, or the first module, we spoke about the essential first steps. And one of the first steps is to select a problem that can be researched. So that's what chapter 3 is all about. Chapter 3 is the first, corresponds to the first section of module 2 or module 2-1. So the chapter goes into starting points for a research question. The very first step in phase one is selecting a problem. Selecting a problem involves decisions, sorting out, narrowing, and clarifying. It involves clear thinking and will often require us to discard our favorite ideas. Very often, the beginning of any research project is merely curiosity. When we start to pursue answers to that curiosity, we are informally or sometimes formally engaging in research. So we are doing research all the time. Perhaps not very accurately, but we still are conducting research in our own way. There are several examples as starting points that you can see in your textbook. If you think about very gerontology-based examples, something as simple as some older adults age better than others, or they do better in later life. So we start to ask why. Who is it that ages better? Does it have something to do with lifestyle? Since several of you are gerontology students, you may be interested or engaged in asking deeper questions as to which of the 8 social determinants of health come into determining how aging proceeds. A different example might be, should we find ways to support grandma or grandpa at home, or is a retirement home a better option? Considerations might be that grandma is part of the family, so the family might be prompted to ask questions. What difference does it make? Will she be more alone at a long-term care facility? What are the financials involved? Again, a situation like this, an important family decision, creates questions and leads to a research process. Sometimes it's a news article. Seniors scammed by door-to-door salesmen. Or you see news articles, 1 in 4 seniors need food banks. Or hoarding is a major concern in seniors' homes. These are all examples of news reports which might provoke curiosity and might lead you to conduct some kind of research. You may have questions. Well, seniors seem to be getting scammed more because it's being reported more. Is this new or is it just being reported? You might be interested in a policy change. For example, the city of Greater Sudbury recently reduced the number of garbage bags you can leave outside. How has this affected how citizens plan disposal of their waste? The key thing to remember is no matter where you start the research process, once you have the starting point, you have to go ahead and narrow down and clarify the question. So let's just review. Typically, there are multiple starting points. So it could be an observation, something that you see, and we spoke about the aging process. It could be a family decision. It could be a news report, or it could be a policy issue that bothers you. Before you start to shape and narrow your question, there's an important concept that is introduced in Chapter 3, and that is the concept of the literature review. The biggest reason for a literature review is for you to be able to embed your findings within existing literature and for you to genuinely do work that is new and unique so that you don't recreate the wheel. One of the important features about the literature review is conceptualization. It's for us as researchers to be able to have a clear idea of what are the concepts involved to the question that we're asking. A literature review assists in identifying a good research question. So it lets us identify a good research question. It allows us to see the appropriate theories that are involved with the question we want to ask. It gives us ideas for research design. It presents variables as previous researchers have studied as it pertains to certain concepts. So for example, if let's say a measure of nutrition is looking at daily dietary intakes and looking at measurements there, that's a good way, that's a good measuring instrument to look at nutritional intake. When we don't have a clearly defined research question or familiarity with literature or an idea of what the biggest debates are with scholars in the field, we're not going to have a very good research question. Once we find the debates that are ongoing in the existing area that we are interested in, we have to truly identify the gaps in knowledge. There might be areas of our curiosity that we start off wanting to explore, but as we go through the literature review process, we may understand that a lot of these answers are already there, and then we might refocus our attention to something else. Obviously, if there are no gaps in the current body of knowledge that we are interested in, then there is no question to be asked. However, if as a researcher you're asking for money to do research, the gap must be made very evident to funding agencies, and you must be able to demonstrate that your research is going to add to filling the gap. All major theoretical approaches in the social sciences have a good deal of research reviews or literature behind them. You have to be able to talk about what the theoretical approach is, and you have to be able to talk about how your method will help you answer your research question. And context must be provided as to how similar questions have been answered. You will get a pretty good idea as you're conceptualizing as to what research design you need and what method you will allow you to capture the most and relevant data. So a research question really takes a while because you're putting all of these different moving parts in synchrony, so to speak, to be able to kind of tail off into your research question, which within itself will not be talking about all of these different things in detail, but it is a precursor for you to start the whole process. So that's why it takes a while to formulate a good research question. Literature review is important not just in conceptualization, it's also important in data analysis. Data analysis is typically done in phase 3 of the research. When you've already collected all your data, you've tabulated it, graphed it, and thinking about it, you're analyzing it. At this stage, what happens is it is important not just to relate our findings to the research question, but it is important for us to embed our findings within the larger debates on a particular topic. For policymakers, to redirect programs, if there are program-involved research, it is important, to again demonstrate to them as to how the conclusions assist with a change in policy. Now, the bulk of the literature review is done during the first phase when we are trying to formulate the research question, get the appropriate theories, figure out the variables, and so on. However, it is a constant process. Once we start, researchers don't stop doing literature reviews once they start collecting data. It's an ongoing process because data collection is not a full-time thing. For example, if I were conducting interviews with individuals, The interview itself might only occupy 30 minutes of my day. So I have all this other time to continue to stay in touch with literature because there's always new stuff that's published. And that becomes important in the data analysis phase and the conclusion phase because it keeps the research contextualized to what the latest findings are and how the relevance might change depending on what new work comes up. So, in creating a research question following the literature review, the objective of narrowing and clarifying the problem is to actually produce a clear statement. So what we want really is a clear statement of the problem to be solved. Once we have a question in mind, the first thing we have to do is we have to break it down. This process is referred to as unpacking a concept. There are several questions that are helpful when we unpack a concept. So let's think of a concept. Think of concept as a big basket of ideas. It's a bunch of ideas that nucleate around a central theme. An example would be health. Health is a concept. Wealth is a concept. Well-being is a concept. When you think of each of these concepts, the reason health is a concept is there can be several variables that define health. Absence of hospital visits, something that can be measured. Number of active days a week. So the idea is a concept is very complex. We must break it down. And the reason we must break it down or unpack it is we need to have something to measure. So important questions are, what are the major concepts? What are the major ideas in this research question? What is happening here? What are the issues? Is there a cause and effect? Is there a relationship between two concepts? So for example, if you want to say that health is associated with, let's say, income. Two separate concepts, right? Income is a concept and health is a concept. So if we hypothesize as such, then we have to break down both concepts into measurables. And this process is called unpacking. Unpacking helps isolate issues of interest much better. So let's try a hypothetical unpacking exercise. Some individuals age better than others. There should be an S here, and I apologize for that. So when we think about this statement, if we want to unpack the big key concepts here, we have to unpack what we mean by some individuals. What do we mean by age better? Okay. So these are the two big concepts, and we have to break them down to understand what it is that we truly want to say that we can measure. So when we say that this is a sentence with some complex context, we really want to ask, do we mean some older adults are more active than others? Are we talking about older adults who live by themselves? Are we talking about older adults who have more life satisfaction? Are we considering income, education, a lack of disease, the presence or absence of a spouse? And if you're thinking about all of these things as to how we want to kind of conceptualize this question better, we're starting to unpack the problem. So unpacking, as you can see, isolates many factors. The reason we need to pick one factor out of several is because otherwise we will have a lot of complex research questions. Now, We may want to unpack it asking, are older adults in better physical health due to higher levels of physical activity? Or are older adults more satisfied due to more social connectivity that they experience? Now, these become very measurable for you. Oftentimes, the literature review is a back and forth process. So as we start to formulate the question, it is a good idea to go back to literature to see what's being done out there. Previous work at the stage for factors and approaches that you can use, you may not have considered certain ideas. You might get new ideas as you start to look at work. You might also want to consult a professor or a librarian or your peers who are very skilled in searching as to what your best method of research literature searches might be. So if you think about a question, should grandma be in a retirement home, since our goal at this stage is to clarify the question, we need to unpack the starting point. So we can start by selecting something small. The goal in this case is to isolate a question for research, not necessarily at this point to find a solution for the problem, because that might be the result of several separate research questions. So let's start by unpacking this. We might want to find out if living at one location is better in terms of support, connectedness, and access to services. We might want to look at how families make this decision. Who participates? Do children have a say? Do all members in the family have an equal say? The other thing we might want to ask is, well, do sociocultural factors have a role? In several cultures, it's completely not okay or unacceptable to put older adults in a care facility. So there are several ideas, issues, and factors, and as we are answering a simple question as to perhaps we should substitute grandma here by saying, should a familial older adult be in a retirement home? And so as we're researching this question, there are several things to consider as we start to break it down. Once we've narrowed down the problem and limited ourselves to a few factors, we need to restate the issue as a researchable question. Researchable questions mean empirical data. And you remember what this term means now. Empirical means something that's observable, measurable, and something that possibly changes. Okay? So there are a few different ways to state a research question. The first way is a hypothesis. Hypothesis broken down means on top of a thesis. A hypothesis suggests a relationship between two concepts. It's considered a positivist or an assertionist way. Of looking at a research problem. It often is seen when concepts are already identified and something is known about the study, and then a relationship is suggested. Examples of hypothesis can be amount of activity, positively correlates to good health. So a hypothesis suggests a relationship between two concepts, two large boxes of ideas. It's always a good idea to diagram a hypothesis, and the reason you diagram a hypothesis is because it makes things clear. I apologize for scribbling on top of the text for the next line, but you will find this in a textbook as well. The alternative to a hypothesis is a research objective. Now, the research objective does not necessarily state a relationship between two concepts, because oftentimes when we're doing research, we do not know that there's a relationship between two concepts, and sometimes, especially in qualitative research, we don't even know what the concepts are, and our research starts off being quite exploratory, and we find concepts and variables to those concepts as we move through the research. Your textbook, Chapter 3, has several examples of diagramming hypotheses where two concepts are related to one another. It's a good idea to go through all the examples and start to look at the different ways to diagram hypotheses. So there are positive relationships and there are negative relationships. A positive relationship is when change in one concept, let's say activity in this case, and we're talking about physical activity here, and if we hypothesize that it's related to health, we'd put a positive sign here and an arrow going this way, stating one causes the other. At this point in time, your textbook also introduces the idea of independent and dependent variable. So the idea of independent variable is that it's the variable that causes the change in the dependent variable, and not the other way around. Now keep in mind, these are for the purposes of research alone, because there is some circularity in the logic here as well, as in someone could suggest that, well, if you had better health, you're likely to exercise more, as opposed to saying, well, if you exercised more, you'd have better health. So I get that in certain situations it can look convoluted as to what is suggested as independent and what is a dependent concept. In most situations, researchers make it abundantly clear as to why they consider one concept as the independent and second as the dependent. Now, in concepts as well, concepts, like I mentioned, are large categories. In order to be able to measure concepts, a representative variable, a variable is a type of a concept. So concepts are broken down into several variables. A variable is something that varies or changes in a concept that you can capture and you can measure. There are different kinds of variables. There are continuous variables like temperature, where it's a range. You can go from 0 degrees Celsius all the way to, you can go from negative infinity degrees Celsius to positive infinity degrees Celsius with every decimal point along the way. There's really no limit to that. But then there are variables that strictly fall into categories as well. Were you born male, or were you born female, or were you born of an undetermined gender? These are categories. These are very strictly determined categories, as we have them right now. Are you pregnant? Are you not pregnant? Again, very strict categories. Are you married or are you not married? Again, very clear categories. So these variables or these concepts are categorical. Your textbook talks about these as well. They're also called nominal concepts or nominal variables, where it is one or the other thing. A continuous variable is the opposite of a categorical variable. Okay, so two new concepts, categorical or nominal, and the opposite, of course, is continuous. Okay, now this is an example of diagramming two concepts, believing that they are associated with each other. Remember, even when we have independent, and dependent variables, while the hypothesis suggests that there is a relationship between two concepts, it does not mean necessarily that one causes the other. And we will get into this in a later lecture, um, speaking about why there are only a couple of different contexts in which we can truly determine that the dependent variable changes due to the independent variable. And most of the times it is association between variables alone. In any case, um, the number of social connections is correlated to positive well-being. I just want you to think about an example. We can use the same example of amount of activity. Physical activity. And if the hypothesis is it leads, because it's positively correlated, hence the plus sign, to greater health. So whenever we have the diagramming of a hypothesis of this sort, the reason one doesn't cause the other, even though they are associated, think about all the exceptions that you can find to this hypothesis. If you can think of several different factors that would confound this relationship, it basically means it is likely association because there are other factors that could change the outcome. Okay? When we state the problem in the form of a hypothesis, the hypothesis needs to be very clear. We have to be able to identify what the dependent and independent variables are. Okay. So for example, we typically put the independent on the right, and we put well-being on the left. And if you're looking at this saying, well, why can't it be the other way around? It's hard to argue because people who are in a good state of mind are likely to connect more to other people, so it could easily be flipped around. But let's assume that this is a perfect situation where people who have more social connections correlate to better well-being. Or if you look at physical activity, if you look at physical fitness and activity, or physical activity and well-being, and so on. Let's take a different example. Spirituality and religiosity. Some of you might be tempted to assume that one correlates with the other. Others in the class might look at this and say, no, one is quite distinct from the other, so a person can be religious but not spiritual, a person can be spiritual but not religious. And some might say, well, it's hard to say, but they often go hand in hand. And sometimes, as we're thinking about our statements, we may not have a clear idea as to if they're associated or not. And so perhaps if you still want to investigate the intersectionality of these two concepts, you may just leave them in a box without necessarily suggesting a dependency of one variable over the other without a sign as well. Anytime we work in an area that we are not entirely sure about what all the concepts are or how the concepts are related, then we don't hypothesize when we state the problem, when we make a research statement. We don't put it down as a hypothesis. Then we go in with a research objective. A research objective is a statement that does not assert a relationship. So for example, if we had a question about the role of breakfast in academic performance, course, most of you may have already been influenced by Kellogg's advertisements or other cereal makers' advertisements indicating that breakfast is the most important meal of the day. So I'm not going to talk you out of it at this point. But the point is, if you were truly interested in understanding the role of breakfast in academic performance, okay, and you didn't actually know that it does or does not help academic performance, then you may want to see the impact of breakfast in all different aspects of a child's day in school. It may be academic performance, it may be engagement in physical activity, it may be interaction with peers, it may be interaction with the teachers, and so on. And also, it's important to keep in mind that breakfast is culturally not the same all over the world. Not every culture necessarily focuses on a breakfast-based system. Anyway, so the idea is you go in with a research objective, not necessarily knowing the impact of one thing over the other. So, for example, let's pick a different example, which is probably a little more easier to understand. The role of classical music in behavior management. So let's assume that you are interested in looking at the impact of classical music played at relatively low subdued volume in a long-term care home, and you were interested to see if it had an impact on people's routines, their moods, responsive behaviors, and so on. Now, because you're not going in with a hypothesis that classical music is related to anything positive or negative, you're actually asking a research question, and you'll be observing for changes in different aspects. Or you may be interviewing the frontline workers such as PSWs and nurse practitioners, as well as recreation therapy aides, and all of these different staff members at long-term care as to what the impact of this constantly playing very diverse but very soft, uplifting classical music is on all of these people, all of the residents. Okay, so that might be something that you might frame as a research question to want to study. So it is very useful to have a research objective when the goal of research is descriptive as well. So oftentimes what happens is when we are trying to explore or understand an idea or a concept, when we want to describe the different concepts involved, a research objective is of far more value. So for example, if you're interested in finding out what is the impact of being female and Aboriginal in Sudbury, it may be possible to guess at a few things that impact doing well in the workforce, having a livable wage, and those things. But truly, to understand more and the concepts involved, you'd have to interview people of Aboriginal origin, females who would be willing to talk to you. And then you might actually get to several concepts. You may uncover concepts, some of which are obvious. You may uncover that there's rampant racism. You may encounter that there's a lot of exclusion, social exclusion. You may encounter a lot of anxiety and fear on the part of Aboriginal females because of what they perceive as hostile environments. But you don't necessarily know that going in, and there might be several concepts that get uncovered during the interview process that you only know once you get into the process. A research objective is also important to understand phenomenology. A phenomenology is studying a phenomenon. What's going on here? And there are examples of phenomena in your textbook. But one of you can think of several things that happen. A phenomena uh, would be right now um, the use of social media to post pictures of yourself and using the internet as a repository for memories. When you think about that, as normal as it might be for a lot of you, about 20 years ago, when digital cameras were not quite as common, people used to use film cameras, and then you'd have to take the film roll over to the store and get it developed. People would think about taking pictures. You wouldn't take a dozen pictures of the same thing. You'd actually contemplate about taking, you'd create a good opportunity for a good picture with the camera. You'd take the picture, and people would expend a decent amount of photographic film, but nothing compared to what we do today with our phones. So that's a change. That's a phenomena. What is it that is contributing to the newer generation, or people right now, it may not even be the newer generation, to people taking a lot more pictures, and also that's one phenomena. Second phenomena might be why are we making our moments so public, which used to be private space many years ago? So these are phenomena. So what is going on? So those kinds of questions don't get answered with a hypothesis. We can't pretend to know the reasons why people do all of these things and suggest that one concept is related to another. So that gets answered only by having a research objective, where the goal is to ask why, and perhaps it's an interview process, or perhaps it's a personal narrative that you use. So if our objective is to identify or describe, the research question is the way to go. Now, this is pretty much everything that's covered in Chapter 3. Again, the lecture component does not go into excruciating detail, and the reason is simple. This is meant to be an overview. Reading the chapter and solving the questions at the back is your responsibility. And as diligent students, I expect all of you to do that. Okay? So if you have already read the chapter, excellent. You're on top of things. If you haven't read it yet, go ahead and read it now that I've given you an outline, and answer the questions at the back and complete all the exercises associated with Module 2-1. All right, thank you, and see you in Lecture 4.